Celiac disease affects approximately 3.4 million people in the United States, but up to 2.8 million, 83%, remain undiagnosed. Celiac disease affects all ages, genders, and races. Research indicates that Black and Hispanic patients have reduced odds of receiving appropriate celiac disease testing when presenting with related symptoms.
Every few years, the symptoms were pretty unbearable, and I'd go to a doctor, and they would connect those symptoms to something else. One doctor literally said the words to me, "I understand many of your cultural foods are fried. Perhaps you should cut back on those things." I really remember feeling somewhat helpless and enraged. So I did find someone. As soon as she walked in the door, I remember, I said, "I've been ignored by white doctors. I've been suffering with these symptoms for most of my life. I want to be tested for celiac, Crohn's, and everything in between." And she placed her hand on my shoulder. "I absolutely think we should run these tests and see what's going on here." They found out that I had celiac.
Beyond Celiac is working to identify and address disparities in order to help improve health outcomes for high-risk racial and ethnic populations and communities.